Well, it's a rare, usually non-cancerous, benign tumor that develops in an adrenal gland. You have two adrenal glands, one located at the top of each kidney. Usually a pheochromocytoma develops in only one adrenal gland, but tumors can develop in both. If you have a pheochromocytoma, the tumor releases hormones that may cause high blood pressure, headache, sweating, and symptoms of a panic attack. If a pheochromocytoma is not treated, severe or life-threatening damage to the other body systems can result. Most pheochromocytomas are discovered in people between the ages of 20 and 50, but the tumor can develop at any age. Surgery to remove a pheochromocytoma usually returns blood pressure to normal. Earlier on this channel, I have already uploaded a short video about this, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms and signs. Well, signs and symptoms of pheochromocytoma often include high blood pressure, headache, heavy sweating, rapid heartbeat, tremors, paleness in the face, shortness of breath, panic attack type symptoms. Well, earlier on this channel, I have already uploaded a video about panic attacks. That is a very informative video, and the link will appear in I button. You can see that video. Okay. There are less common signs and symptoms that may include anxiety or sense of doom, constipation, weight loss. There are symptomatic smells. The symptoms which I told you may be constant, or they may occur or get stronger occasionally. Certain activities or conditions can make symptoms worse, such as physical exertion, anxiety or stress, changes in body position, labor and delivery, surgery and anesthesia. Now I'll tell you relation to some foods. There are foods that are high in tyramine, which is a substance that affects blood pressure. That can also make symptoms of pheochromocytoma worse. Tyramine is common in foods that are fermented, aged, pickled, cured, overripe or spoiled. These foods include some cheeses, some beers and wines, chocolate, dried or smoked meats. Certain medications that can make symptoms worse include monoamine oxidase inhibitors such as phenelzine, trenylcypromine, and isocarboxazid. Stimulants such as amphetamines or cocaine can also make symptoms worse. Although high blood pressure is a primary sign of pheochromocytoma, most people who have high blood pressure do not have an adrenal tumor. You should talk to your doctor if there are factors which I am going to tell you are applicable to you. If you have a difficulty controlling high blood pressure with current treatment, if there is an episodic worsening of high blood pressure, or a family history of pheochromocytoma, or if you have a family history of related genetic disorders, that is multiple endocrine neoplasia type 2 MEN2, von Hippel-Lindau disease, familial paraganglioma, or neurofibromatosis 1. Okay. Now I will tell you the causes. Researchers do not know exactly what causes a pheochromocytoma. The tumor develops in specialized cells called chromaffin cells located in the center of an adrenal gland. These cells release certain hormones, primarily adrenaline, that is also known as epinephrine, and noradrenaline, that is also known as norepinephrine. These help control many body functions such as heart rate, blood pressure, and blood sugar. Now I'll tell you some role of these hormones. Well, adrenaline and noradrenaline trigger your body's fight or flight response to a perceived threat. The hormones cause your blood pressure to increase and your heart to beat faster. They prepare other body systems that enable you to react quickly. A pheochromocytoma causes more of these hormones to be released and causes them to be released when you are not in a threatening situation. Related tumors. While most of the chromaffin cells are located in the adrenal gland, small clusters of these cells are also in the heart, head, neck, bladder, back wall of the abdomen, and along the spine. Chromaffin cells tumors called paragangliomas may result in the same effects on the body. Now I'll tell you the risk factors. People who have certain rare inherited disorders have an increased risk of pheochromocytoma or paraganglioma. Tumors associated with these disorders are more likely to be cancerous. These genetic conditions include multiple endocrine neoplasia type 2, MEN2. It's a disorder that results in tumors in more than one part of body's hormone-producing endocrine system. Other tumors associated with this condition can appear on the thyroid, parathyroid, lips, tongue, and gastrointestinal tract. Von Hippel-Lindau disease can result in tumors at multiple sites, including the central nervous system, endocrine system, pancreas, and kidneys. Neurofibromatosis 1, NF1, results in multiple tumors in the skin. These are neurofibromas, pigmented skin spots, and tumors of the optic nerve. Hereditary paraganglioma syndromes are inherited disorders that result in either pheochromocytomas or paragangliomas. Now I'll tell you the complications. High blood pressure can damage multiple organs, particularly tissues of the cardiovascular system, brain and kidneys. This damage can cause a number of critical conditions, including heart disease, stroke, kidney failure, problem with the nerve of the eye. Cancerous tumors. Rarely a pheochromocytoma is cancerous, that is, malignant, and the cancerous cells spread to other parts of the body. Cancerous cells from a pheochromocytoma or paraganglioma most often travel to the lymph nodes, bones, liver, or lungs. Now I will tell you about the diagnosis. Well, when the patients come to us, we may order several tests, and there are some lab tests which I should tell you. These measure levels of adrenaline, noradrenaline, or byproducts of those hormones in your body. The first test is usually a 24-hour urine test. In this test, you collect a urine sample every time you urinate during a 24-hour period. Ask for written instructions about how to store, label, and return the samples. Blood test. Your doctor draws blood to be tested in the lab. For both types of tests, you should talk with your doctor about special preparations such as fasting or skipping a medication. Do not skip a medication dose without instructions from your doctor. And now I'll tell you some about imaging test. Well, if the lab test results suggest the presence of a pheochromocytoma or paraganglioma, your doctor will likely order one or more imaging tests to locate a possible tumor. These tests may include CT scan, that is a specialized X-ray technology, MRI, which uses radio waves and a magnetic field to produce detailed images, MIBG imaging. This is a scanning technology that can detect tiny amounts of an injected radioactive compound taken up by pheochromocytomas or paragangliomas. Positron emission tomography, that is PET scan. This is also a scanning technology that also can detect radioactive compounds taken up by tumor. There are imaging studies that can be done for other reasons. A tumor in an adrenal gland might be found during imaging studies done for other reasons. In such cases, your doctor will generally order additional tests to determine the nature of the tumor. Now I'll tell you about genetic testing. Your doctor might recommend genetic tests to determine whether a pheochromocytoma is related to an inherited disorder. Information about possible genetic factors can be important for so many reasons. Because some inherited disorders can cause multiple condition, test results may indicate the need to screen for other medical problems. Because some disorders are more likely to be recurrent or cancerous, your test results may affect treatment decisions or long-term plans to monitor your health. Results from your test may suggest that other family members should be screened for pheochromocytoma or related conditions. You should ask your doctor about genetic counseling services that can help you understand the benefits and implications of genetic testing. Now I will tell you the treatment. The primary treatment for a pheochromocytoma is surgery to remove the tumor. Before you have surgery, your doctor will likely prescribe specific blood pressure medications that block the action of high adrenaline hormones to lower the risk of developing dangerously high blood pressure during surgery. Now I'll tell you about some pre-operative preparations. You will likely take 2 drugs for 7 to 10 days that help lower blood pressure before surgery. These drugs will either replace or be added to other blood pressure drugs you take. And the first group of drugs is alpha blockers. These drugs keep smaller arteries and veins open and relaxed, improving blood flow and decreasing blood pressure. Alpha blockers include phenoxybenzamine, doxazocin, that comes with the name of Cardura, and prazosin, that comes with the name of Minipres. Side effects might include irregular heartbeat, dizziness, fatigue, vision problems, sexual dysfunction in men, and swelling in the limbs. Beta blockers. These drugs cause your heart to beat more slowly and with less force. They also help keep blood vessels open and relaxed. In your surgery preparation, your doctor will likely prescribe a beta blocker several days after starting the alpha blocker. Beta blockers include atenolol, that comes with the name of Tenormin, metoprolol, that comes with the name of low pressure, and propranolol, that comes with the name of Indrol. Possible side effects include fatigue, upset stomach, headache, dizziness, constipation, diarrhea, irregular heartbeat, difficulty breathing, and swelling in the limbs. High salt diet. Alpha and beta blockers widen the blood vessels, causing the amount of fluid within the blood vessels to be low. This can cause dangerous drops in blood pressure with standing. A high salt diet will draw more fluid inside the blood vessel, preventing the development of low blood pressure during and after surgery. But normally, in cases of hypertension, we recommend low salt diet. But in this case of pheochromocytoma, because of the danger of low blood pressure with these alpha and beta blockers, we recommend high salt diet. Now I'll tell you about some information about surgery for this. In most cases, your surgeon removes the entire adrenal gland with a pheochromocytoma with minimally invasive surgery, laparoscopy. Your surgeon will make a few small openings through which he or she inserts wand-like devices equipped with video cameras and small tools. The remaining healthy adrenal gland carries out the functions normally performed by the two. Blood pressure usually returns to normal. In some cases, such as when the other adrenal gland has been removed, your doctor might remove only the tumor, sparing some healthy tissue. If a tumor is cancerous, the tumor and other cancerous tissues will be removed. However, even if all of the cancerous tissue is not removed, surgery might limit hormone production and provide some blood pressure control. And now I'll tell you some options for cancer treatments. Well, very few pheochromocytomas are cancerous. As such, research about the best treatment is limited. Treatments for cancerous tumors and cancer that has spread in the body related to a pheochromocytoma include MIBG. This is used as an investigation and also for treatment purpose. This radiation therapy combines MIBG, a compound that attaches to adrenal tumors, with a type of radioactive iodine. The treatment goal is to deliver radiation therapy to a specific site and kill cancerous cells. Peptide receptor radionuclide therapy, that is PRRT. This combines a drug that targets cancer cells with a small amount of radioactive substance. It allows radiation to be delivered directly to the cancer cells. One PRRT drug, that is lutetium Lu-177 and dotatate, and that comes with the name of Lutathera, is used to treat advanced neuroendocrine tumors. Chemotherapy. Chemotherapy is the use of powerful drugs that kill fast-growing cancer cells. Radiation therapy. This may be used for symptomatic treatment of tumors that have spread to the bone, for example, that are causing pain. Targeted cancer therapies. These medications hinder the function of naturally occurring molecules that promote the growth and spread of cancerous cells. Well, this was my video about pheochromocytoma, and I have also highlighted something about paragangliomas. I hope you like this video. If you have any questions, you can ask in the comment sections. Thanks for watching this video. See you in next video. Bye for now.